back. Thank you for joining us, and thank you for giving us a little bit of time of your day-to-day. And speaking of time, we've got a doctor here that's been coming up here a long time, Dr. Scott Beals. And Scott, Dr. Bill, you're a dermatologist out here in Andalusia, and your office is open on
Wednesdays and Thursdays right now.
Wow. And you know, take an old hardware man, the skin, that's what dermatology is all about, isn't it, Doc?
It is, and it does take a beating from something that we love in life. And we love to get a little bit of tan, but unfortunately the sun isn't always good for our skin.
And you and your wife just happened upon Andalusia by magic? You just came up here one day and liked the community?
We did. We were driving around looking for land up in Alabama. We had to do a ranch, cattle and horses, and just fell in love with the community. And I talked with the hospital and set up an arrangement. We came up here 1 day a week. Now we're at 2, and we're trying to get 3 or 4 days a week up here.
That is great. You know, his office is located down in the new office suites that are, it's 301 Medical Drive. And if you go into the hospital on the oncology and mallet drug side, you go down and you'll see a sign that says take a left.
Right.
You go down the hill and it's a great place to. Andalusia Hospital is now Andalusia Health has done a great job of becoming a regional hospital. And did that influence your decision at all?
It did. Part of being in a community is that the community trusts and has a lot of faith and value in the hospital. We recognize that right away. And the CEO and staff up there, I can't be more nicer to the patient. That's key to what my business is old-fashioned medicine, which is sort of going away in some places. But we love working with it. It's like family there. We do a good job.
Well, I'm impressed that we've recently got a new Dr. Kelly taking care of orthopedic, and got Dr. Price cardiology, and the hospital just got certified to be a place if you are having heart trouble that they're actually going to give you the same service you would get in Pensacola or Dothan.
Oh, easily. They have a full complement of staff of varied specialties, and that also was very key to my field. I get referrals from everything from kidney transplant patients, heart patients, and a lot of that affects the skin. And they've opened their arms to help my business, helping them with their patients, and we have fun doing it.
Really? How wonderful. Now, do you do, dermatology is a serious field, of course, and there are things that can be on your skin that are actually very harmful to your health.
It is true, a lot of people think of just dermatology acne, but my specialty is skin cancer. If you think about the most common cancer in the United States is skin cancer. In fact, 1 in 5 Americans will develop a skin cancer in their lifetime. So that's 8,500 skin cancers a day are diagnosed in the United States.
That's incredible, Dr. Bill. And the thing I love about our regional hospital is in having a dermatologist in Covington County, and we do have listeners all over the county. And if you're in your home right now and you just think that you may have something that's abnormal, give them a call. Because if it isn't, it's okay, right? I mean, that's good.
It really is important. The World Health Organization recommends at least an exam annually or every 6 months. And if you think of the incidence, the most common cancer in the United States is skin cancer. It's best to get checked up. From years of sun exposure, when you think of just a few burns before the age of 20, that your risk of skin cancer is 80% greater. And if you lived in the South, you got a few sunburns.
Yeah, you know, I was in the swimming pool with my grandchildren yesterday, and we kept applying, you know, with our hands, we'd take them out. But even at that, they were golden red. I mean, you know, they were red last night. They were radiated.
That's me. I go out in a few minutes and I'm burned. I wish I'd have used it a lot earlier in life. But preventing the sun exposure, which is the #1 risk factor for skin cancer, studies show you probably decrease the incidence of skin cancer by about 300 million cases a year, and that's why the American Academy of Dermatology pushes it so much to use at least a 30 sunblock with about 5% zinc oxide in it, and reduce your risk of skin cancer.
Can you do anything about my chin? Do you do
I don't jump in the cosmetic.
you don't do cosmetic,
no,
okay.
although I got the same problem. We
Oh,
don't
you
get
looking
that with
good.
time, but no, I don't.
I thought maybe you'd already worked on your own chin there.
No, I do not.
I just wondered about that. Yours is strictly medical.
Strictly medical skin cancer. Now we do some cosmetic. I have a cosmetic center in Niceville.
In Nashville.
It takes care of most of the sun-induced skin changes, where you do repetitive treatments to reduce your sun freckles and those age spots that we don't want to stick around, and a little bit of the red hue we get in our skin. But most of those are things that we've paid the price for years of sun exposure.
It's always amazing to me that people will pay $1 million for a condo in Destin and then go out and turn their skin into leather.
They do. They don't realize the #1 cause of aging of the skin is the sun.
Really?
#2 is smoking. So if you can prevent a lot of that sun exposure early in life, your skin will outlast you a lot longer. And to tell you the truth, a lot of people come in at the age of 45, 50, and they want to reverse the clock, and it's a little late at that time.
Well, when you were growing up, you actually went into the military first, didn't you?
I did. I
You
did.
enlisted in the Air Force?
I did. From New York, I came down here to play baseball along the Panhandle here and played with the Cincinnati Reds for a little bit, and then jumped out and went into the military to finish up my medical degree. I was a physician assistant for a while, then went and did family practice for about 8 years, and then got out of the military after about 15 years and went into dermatology at University of Texas.
The reason that I wanted you to tell that part of your life is because Lurleen B. Wallace has got a technical college here in Covington County, also overnight, and they're teaching physicians assistants like in the operating room. And we have a friend that's actually got a child that's doing that. And now they're beginning. They had the the LPN program. Now they're starting an RN program here in Covington County, and it's so important that people can play baseball, be in the military, but then they don't have to just automatically go to med school. You can work your way up to being.
Well, there's multiple areas of medicine in the field of medicine besides just the laboratories and different areas of the hospital you can work. But being even a mid-level provider, a physician assistant or nurse practitioner, so that country doctor type person that can take care of those needs that in today's healthcare you really need for just urgent care and taking care of some of those common things that come in every day so that the physician can concentrate on the more difficult cases.
That's what Dr. Bill reminds me of. I'm very comfortable talking to him. He reminds me of the old country doctor like Dr. Cundy, where you could sit down and talk to a doctor and not feel like you're just a number. I mean, you love people, don't you, doctor?
That's why I do this job, and that's probably why in today's world some of the old guard doctors are a little bit frustrated with the system, because we like to sit down and talk with our patients and become familiar with them and know what their problems are. In today's world, just doing the note takes 15 minutes in today's world for healthcare, and that's what's frustrating.
Lord have mercy. And Dr. Bill, did your wife come up here with you during the week?
She used to quite a bit. Now I bring a whole staff.
Bring the whole staff.
So now she
has to keep
she
those.
has the paperwork. It used to be where she assisted me, so now it's pretty much a full-time paperwork job in today's medical area.
Just like all of us, just
yeah.
abusing our family, and just make them do all the
in
paperwork.
every field, it's become more popular.
Dr. Bill's a dermatologist. He's not new to Andalusia, he's new to me. He's probably new to this audience, and we want to ask you if you have any thoughts in your mind that you should go see one once a year according to the medical field, shouldn't you?
You really should. You really should. When you think of 1 in 5 Americans will develop a skin cancer in their lifetime, and the risk of melanoma. Our main cancers are basal cell, squamous cells, and melanoma is the big one. When you think about catching a melanoma from overexposure to the sun, I mean, if that melanoma gets past its local spread, the 5-year survival rate can go down to less than 50%. So our whole goal is to identify our common moles that we think have been there for years and hadn't changed. And most people think it's been there for 20 years, but really those subtle features that a dermatologist can pick up or with a special eye can catch and cure disease and prevent a fatal situation.
Well, it's a pretty timely subject because the sun is at its peak in the next few months, and really there's some ways you can protect yourself from the sun.
It is. In fact, this time of the year, the UVA content is a big risk factor, the #1 risk factor, and just wearing a little sun protective clothing, broad rim hat, and using a sun protection with about a 30 SPF and zinc oxide on at least, something good name brand you're going to use regularly because they get a little messy, and do that routinely. As I said, you probably prevent, studies say, probably 300 cases of skin cancer, 1,000 cases a year by just wearing that sun protective.
That is truly incredible. We're not going to just fill out Dr. Beals' telephone number. It's going to be on our webpage, and you can always call Andalusia Health, which is the former Andalusia Regional Hospital, and they will certainly direct you. Or if you go to your regular physician for a checkup and you just think, look at this doc on my arm, and he can get you an appointment over there with Dr. Bill as a referral. And it's just wonderful to have a dermatologist 2 days a week in Andalusia. It's great.
Hopefully.
And yeah, hopefully more. And I hope that we can, if anybody has any farmland that where the doctor can raise his horses and cows, this would be a good opportunity for you too. A lot of our people live on farms that watch this show.
That's what we love about this community. They have true values that I love.
And they can grow, we do a real good job of growing food for horses. It grows almost.
It is ideal for horses and cattle.
It really is.
It is.
It's a great place. And it's wonderful to meet you, Doctor, and Dr. Bill. And I hope that if you're watching this show, again, we want to thank you for the time you've given us out of your day. We want to ask you to please consider shopping local with our doctors and our hospital, and to use that service, that dermatology service out there. That's a great service for our community, and we thank you for coming, and thanks for being here today.
If there's anything I can do, give us a call. We got a great staff. I make you feel at home.
Good to have you, Doctor.